And it's 6 minutes after 7. You're welcome to my banner. We're talking sexually transmitted infections. They spread primarily through person-to-person sexual contact. We're told that there are about 30 different sexually transmissible bacterial, viruses, and parasites. But what is deadly for us here in our country? We know that in the UK now, an outbreak of highly drug-resistant gonorrhea has been detected in the north of England, triggering a national alert. 15 cases so far have been detected by Public Health England. The British Association for Sexual Health and HIV have said. We're looking at the Ghana situation, and my guest in the studio, Edith Asari-Mensah, is a public health nurse with the LECMA Health Directorate, and Beatrice Okun is a deputy DDNS. I'll leave her to explain the DDNS, Osukloti Sub-Metro, but they're all public health nurses. And I want to say good morning to you and thank you for joining us.
Good morning and thank you.
Thank you.
Okay, so DDNS, Deputy Director
Nursing Services.
Okay, cool. All right. So we know about, I think you also have a case, but this resistance to gonorrhea elsewhere, do we have the same situation in Ghana?
Yes, we are currently doing a study with U.S. Navy on gonorrhea resistance. So we are looking at how people are getting the drugs that we're formerly using, people are getting resistant to it. So we are looking at how many people come with gonorrhea, how many people have taken drugs, which drugs have they taken, is it working for them, is it not working for them, why is it not working? So it's a study that is currently going on between the Ghana Health Service, the U.S. Navy, and Noguchi.
Okay. So is it, but we haven't, it means that we are thinking that it probably is, but we haven't tried and tested.
Yes.
So we can't say for sure.
Yes, looking at it, not scientifically, but just looking at the numbers that come and the history that we take, we are thinking that there's a resistance.
Is it the same drug, by the way? I mean, do we use one drug for?
Yes, it's the same drug that is used in Ghana, that is used in UK and US. So we are looking at, it looks like the complaints are the same. So we are looking at it. Looking at it by face is the same, but we are not doing the scientific research. It has been going on for the past 1 year. Yes.
Okay. So can we get into some of the sciences now, Auntie V?
It did.
Yeah. Okay, sure.
Actually, for gonorrhea management, when we talk about managing STIs, we actually look at WHO standard, where we use the syndromic approach. And we use those specific drugs that England is as well using, and what we have used for the past. Normally, when we come on air, we wouldn't want to mention the drugs because people might see as a source of giving themselves medication. Yes, so basically, we actually manage them syndromically. For WHO standard, we look at managing them syndromically in a way that, per the symptoms you present, you are giving treatment according to the standard guideline. For instance, in every institution or setup, we have a protocol, and per the SOPs, standard operating procedures, or the standard guideline, we use the treatment that have been actually spelled out. And then people, per the treatment that have been given, have used that as a basis, and then they want to go back to actually have the same treatment. But for STI, though you might be presenting with the same, with another person, it might be actually the organisms may differ. Exactly. Okay. So that, yes. So, and normally people are coming out more with these infections because the recurrent ones, because they have actually not complied with their medication and have not had their partners manage, and therefore are coming because of these reasons. So, for instance, if history has been taken, well, good history is taken, which is spelled out in the syndromic management. We actually take a history whether your partner has been managed. If not, then you are reinfecting yourself, and therefore the need to call in your partner to be managed. Else we'll be treating a gonorrhea resistant STI. So there's a need also to look at this area.
Okay. I was hoping to also get some signs of if you're resisting to the drug. I mean, what would it mean? How can you tell?
When you are resistant to the drug, you get the symptoms that it goes and comes It's on and off. It's repeated, the same resistance. The same symptoms goes, you take the medicine for some time, then it goes, then it resurfaces. So it's a recurrent thing.
Okay.
That means that you are resisting.
Okay.
To be specific, for a male, you may be having a discharge from your penis. And if this male is managed and comes back and complaining that the discharge has been ongoing, it's not gone, then it means that there had been a resistance. If we rule out compliance and reinfection, so this male will come and say, I have this pain, and then discharge is coming on. But for a female, she also may come with the repeated discharge, discomfort in the vagina, and then they also have pain when urinating and difficulty. At a point in time, the female may have complications like moving up onto the other related organs, the uterus, the cervix, and all those things. And they may even have complications in the fallopian tubes. So that is our worry now. Yeah.
Okay. So when we talk about, the situation that we have confronting us today, what would you say is the #1 STI that's killing people?
STIs usually are not fatal. They are debilitating. They worry you. You get it and it comes, and you get it and it comes. But it causes complications. It is very difficult to manage the complications when you do not get the right treatment. So the ones that are fatal is, HIV is an STI, but we normally think that, HIV is not. HIV is the #1 killer, but the others are not so dangerous, but they are also very, very worrying. Yes.
Okay. All right. We have to take a break here. We'll be back with more here on this particular subject that we're discussing. Stay with us. Okay, so we're still talking on this subject of STIs, and joining the conversation, I've got 3 strong women on this subject. It tells you how important it is. Juliana Sefa is the Deputy Director of Nursing Services, Greater Accra Region, Greater Accra Health Directorate. So welcome to the conversation.
Thank you very much.
All right. What I was asking was for you to tell us the deadly STIs as we have it today. You mentioned HIV/AIDS. So, any more to add, Edith?
Yeah, to add to, for STIs, they have been categorized into 4. We have the discharges, where a male or female could have a discharge from the female could have a discharge from the vagina. For a woman, they have a normal discharge. It becomes a worry when she's having a discharge and it's itchy, and it has a smell, and it's making you discomfort, and it's profuse. The color will tell the difference, whether it's a normal one. And also for a male, you don't expect a male to have a discharge except when he has an orgasm. But for him to have an unusual discharge, then it means he has, or probably he might have seen these discharges in the panty. Yeah, secondly, we also talk about the ulcers, which are the sores. For the ulcers, they are related to herpes. For herpes, the common one in our local adage that we call anansi, it could also occur at the genital area, and then it starts like a
anansi,
yes.
Genital area?
Yes.
Yes, which you call the genital herpes, which could also rupture, and then it could create a sore. Syphilis also could make a person have a sore when the person have a genital ulcer. Thirdly, we also talk about the swellings. For a swelling for no reason, you see a swelling at the inguinal area, and it's an STI-related swelling. You have to rule out certain surgical conditions. If there is no sore or there is no fall or anything, and you have the swelling, then there's a problem with you. It means that you may have any of the STI-related organisms. The 4th one has to do with the growth, where we talk about the genital warts, which are some few pictures here to show. Yes, exactly.
So we're going to be showing you some pictures. Hopefully it doesn't scare you.
Yeah. So these are the swellings and genital warts. Actually, we talk about the human papilloma virus, which is actually causing it. And for women, they are likely to actually develop cervical cancer. So that is why for any woman, when you are sexually active, even from the lowest age, there's a need to go for a cervical screening also, so that it could be detected early, and then something could be done about it. So for instance, if you have an unprotected sexual intercourse, you are likely to pick up these conditions I have spoken about.
Yes, but just to add to the warts, It normally doesn't start like this. It starts with some rashes or pimple, something like a pimple, a raised pimple on the genital area. It starts sometimes 1 or 2 or 3. And sometimes people think that it's cocoa, and they put all sorts of medications on it. If you do that, it doesn't go, and then it grows to this stage, because if you don't get the right treatment, it will never go. So it starts a little, it starts small, and then it comes.
It develops like this.
Yes, it develops like this.
Yeah. Auntie Julie, you know, okay, unless you want to add something.
I want to say the growths. When you look at the picture, it's almost covering the whole vulva, and that is where it becomes a big issue. Let's say if the woman is pregnant, it means the person has to go through cesarean section,
because if you're doing natural birth, that's where the baby's going to come from.
And so when it blocks the area, that is where the seriousness comes in.
She did mention about pregnancy.
Yes.
I must say that pregnancy, we have the pregnancy-related genital warts.
Yes.
So after delivery, you see it going off entirely if it's not contracted to sexual means. But we haven't looked at how we could also contract sexually transmitted infections.
Yeah, we will. I wanted her to also touch on, following what she said, the color, because she said sometimes some of the discharge, depending on the color, then you should be worried.
Yes.
So what color is normal if you're female?
Normal, I want to say is some white. It is white. Okay. But we have some yellowish or creamy discharge. At times it looks like keddy milk. That is how it is. And at times too, it may follow some blood stain, and it's very offensive. At times it's greenish and frothy. So that is how the seriousness of the discharge.
The discharge. Yes. Okay.
I just want women not to be too worried about discharges that they have. The normal discharge is crystal clear. It's colorless. It's crystal clear. But if it changes from crystal clear to something else, that is where you should be worried.
But how much of the discharge should you even have in terms of the quantity?
It depends on an individual. Every individual has his or her own amount of discharge. Some have heavy, some have slightly light. It's just like the menstrual period. You know, others have a heavy flow, others don't have a heavy flow. So it's just like that. But if it becomes too much for you, you know, every woman knows when she's bleeding too much or not. So if your normal discharge, the crystal clear discharge, is becoming heavy, is becoming too frequent, that you have to be worried.
Okay. Let's get on to...
Let me say this. At times, it's when you put the patient on the couch and examine, before you realize that you have a lot of discharge in the service. So it depends. Someone may tell you that, oh, I'm having some slight discharge, but on the examination, that is where you realize it's not.
It's not small.
Yes,
it's a lot.
Yes.
Okay. So let's get on to the subject of what it is. How do we even get it?
Yeah. Before then, there are certain indicators that we use when actually establishing the fact that someone have an STI-related discharge. Some of the indicators are: one, is the person sexually active? When we talk about being sexually active, is the person having sex? And has the sexual partner been regular or a casual one? And has the sexual partner complained about any discomfort from the penis? Now, ways of having sex have varied. We have male to male, female to male. So we need to find out whether the partner has complained of any of these symptoms. So that will tell you the person have an STI-related discharge. And for pregnancy too, the women are likely also to have a discharge because of the hormonal effects during pregnancy. So they may also show a worry. But when they come, the midwife will tell them it is normal. But some of them don't take it lightly because they think once you have a discharge which is far above your baseline discharge, then it means you have a worry. So there's a need also to look at this. You need to, for a woman, normally why we get worried is we put a lot of things into our vaginas and doing a whole lot of things, and we get worried over these things. When we lose the potency for the normal discharge or the normal flora that is ideal in a woman. Yeah.
Can you also go without any discharge at all?
As a woman?
Yes, as a woman.
Yes.
Okay. And there's nothing wrong with you if nothing is coming out?
Normally, you have the normal flora in the vagina. And if you don't have infection, it will never come out. So, as education to our clients, we normally talk to them not to. Some people clean, and if you clean the normal flora in the vagina, then you allow other infections to come in. So as long as is there, the normal flora is there, without you using your hand to clean, you can go around without any discharge.
Okay.
So long as there's no infection, you will not get any discharge.
All right.
You know, the vagina is not totally dry. It's moist. The vagina is normally moist. So that one, that's okay. So if the vagina becomes too dry, then there's also another, there's a problem. Yes, it should be moist. And according to, following the menstrual cycle, you know, there are days that you feel wetter than other days. So that one is normal.
Okay. We'll come to, because I've got questions on how to get the place tight. You know, people want to get the place tight and how properly you can clean it. But let's get onto the issue of the symptoms of STIs and, you know, how you can... You started explaining it.
Yeah, for discharges, like I mentioned earlier, the woman is likely to have a discharge which is more than the normal one she has. And then she's likely to have pain when urinating. And then at times she may even experience pelvic pain. That means the infection is climbing up to the other surrounding organs. There are times that she may not even show any symptoms at all, except that the immunity goes low and probably she might start having these symptoms. But I did mention also about the genital herpes. For the first episode, women are likely to have discharge. So there's a need to take a very good history, which we normally do at the facility. So these are the signs of discharges per a woman. And for males, like I said, if for no reason you are not having your orgasm, why would you be having an abnormal discharge? And then experience the discharge after a few minutes or hours after unprotected sexual intercourse. And then they have pain when urinating. They feel there's a discomfort in the urethra where the urine passes through. And then they may be having also some pain at the upper part of the lower abdomen. So this will tell you there's an infection. And then a very good history will tell you that there's a problem with this male.
Okay.
Yeah. Sometimes in the male, they feel itching in the penis. So they want to scratch, but how can they scratch? You see, so when you feel that you want to scratch inside, then it's doing that there's a problem. And then they urinate more frequently, and the urine is just a short one, little pieces. It comes 5 minutes, you want to urinate again, but normally that's not how you urinate. So when you start getting such symptoms, and then you know that you've had unprotected sex, then you should think about having an infection.
And to be, I wanted to ask, where do you run to? I mean, when you realize there's a problem, who do you go to first?
Go to the nearest hospital. Go to the nearest hospital.
Not the pharmacy?
No. Go to the nearest hospital. In fact, most of the clients who report to the clinic, most of them have gone to the pharmacy. The reason is, you know, stigma. People are shy to come to hospital. A male comes to the hospital, I have pain, I have itch, maybe I have sores, there are rashes on my penis, and I'm discharging. They feel shy. So they go to the pharmacy, whisper something into the pharmacy attendant, and then he gives them something. You get the relief, but you will not treat the causative organism. So that is where you can also get resistance, because until you go to the hospital and they give you the correct, I'm not saying the pharmacy will not give you the correct treatment, but it's better to go, because there are other things that might be causing the discharge.
Yeah.
There are other diseases that may be causing the discharge.
So, Auntie Julie, should you stop having sex once you realize, oh, there could be a problem? Maybe it's itchy or something?
No. But I don't know whether she mentioned burning sensation. Some do complain of burning sensation. And most of the time, it's about 70% of females are not able to tell you they have infection unless they come into contact with a male who gets the reaction.
Oh, so we rather don't talk about
most of them.
The females would
easily,
you know, come to the health facility and say...
No, they may not identify they have the infection unless she comes into contact with a male who about 2 to 5 days complains that she's having discharge pain when she urinates. So that is another issue.
Okay.
And the question again.
Oh, should you stop any sex activity once you realize there could be a problem?
Once you have the infection, for the period that you are on medications, you stop having any sexual activity. Yes, and it's very important that your partner also, you invite your partner to also go to the clinic for management, because partner notification is very, very important.
Yeah.
Otherwise, they will reinfect themselves. So it's very important that you wait till the time, whether you are taking the drugs for 7 days or 14 days, you have to wait. And both partners will be on treatment and sure they have completely treated before they go in for sexual activity again.
I don't know if it's maybe a bit complicated question. If you haven't had any sexual activity outside the one person that you do with, how can you get it? Because sometimes people get it and they are wondering, where did I get it from?
I did mention that there are other causes that can let you have this discharges. So you could be having another medical condition, other conditions, diabetes, other things can let you have these symptoms that we are talking about, itching, discharges, and other things. So that is why it is good, or it is appropriate for you to go to the health facility, for you to be properly screened, and then know that, oh, this is what is happening. You have another condition. But if you have the same person, it could also be due to
reinfection.
Not reinfection. It's due to hygiene. Yes.
Like you're not taking care of yourself.
You're not taking care of yourself. The way you bath, the way you wash yourself is not proper. Maybe the panties that you use, there are people who will not wash their panties, and they will pack the panties and wash them anyhow, not dry. Yes, so the panties that we wear and some of the things that we put in the panties, you don't even know where it was stored properly, whether it was stored properly or not. All this could. So if you compromise your hygiene, you could also get the infection.
Let me announce because this is such an important conversation that we want you to get involved. If you've got questions on any of the things that we're talking about here, you can give us a call now on 0302-211-69102, 0302-211-69102. We put a lot of things in the panty. Apart from the pad, we put liners in the panties. Are they good?
Well, for liners, I might recommend that. Well, it depends on where it's coming from, because some of them are being deodorized and it's causing a lot of problem. For the vagina itself, it's a self-cleansing organ. You don't need any medication.
You know, you keep saying that, but we don't seem to be convinced by that. That's why we do all sorts of things.
It's a mindset. It is. It is. It is.
You know, we always say, excuse me, we always say that it's not proper to wash the vagina with any deodorized chemical. It's only if you get clean water to wash the vagina, you don't have a problem.
I'll come to how do you wash the penis, because we don't talk about that much. I've got Bashir joining us. We'll talk to him and then we'll come to you. Hello, Bashir. Good morning.
Good morning, madam. Welcome to your program.
Yeah, we thank you for joining us. Let's hear you.
Okay. Then, if you are now want to know, now that you know the causes, what are some of the treatments you can do so that.
Okay.
So when you know some of the health facilities, you can even go there, and some of the nurses may also prescribe that once you are not having the nurse, you might not know whether that's the right drug, or if you also advise when you go to one hospital, you go to another hospital to confirm the drug that is given by the first facility.
No, I don't quite get you. Okay. What exactly are you asking? Can you know the treatments?
Okay, I said you know, we the ordinary people walking in the street, we might not know this is a treatment for the particular disease. So I'm saying some of the nurses or the health attendants who might not know some of the things. So I'm saying that when you go to one facility and you are being treated, you go to another facility to compare whether the treatment you are giving the first facility is the same with the treatment you are giving the second person to know that's the right treatment you are using for the disease.
Oh, okay. All right. I get your question, Bashir. Thank you. But, I mean, I think what Auntie had said before was they would not mention names of drugs because that would mean you can just go and you want to buy. But your case could be different. What is wrong with you could be different from, you know, that kind of thing. So you always have to get tested. That's very important. But I don't know about getting treatment here and cost checking elsewhere.
We have a treatment guideline for managing sexually transmitted infections.
Okay.
And health workers have been trained to manage sexually transmitted infections using that protocol. So every facility, talking about Greater Accra region, every facility you visit where they have personnel trained in managing STIs is the same drug we use all over.
Okay.
Yes. So there's no need of comparing what you get from another. A few private facilities. That is where you may not get the training. But most of the facilities in the region, we have personnel trained to manage sexually transmitted infections.
Okay.
In the various facilities.
All right. I'll give you the opportunity, but let me speak to Abdul, who is hanging on the phone line. Hello, good morning.
Good morning.
Yes, sir. Thank you for calling. Let's hear you.
You're welcome, Mama. I've been waiting to see this on TV.
Say again?
I said I've been waiting to see you display this on TV.
Oh, you've been waiting for us to discuss this on TV?
Yeah.
Oh, okay. All right.
Yeah, because I've had a sexual infection for some time. I keep on treating it and it's not going.
Okay. So let's talk about how you've been treating it.
Yeah, I went to a nearby health facility and I was given medication. So I keep on taking the medication till it's finished. But I still experience it the same. Okay.
But this is very personal. Do you engage in any sexual activity whilst you're on the drug?
No, I was advised to do sexual activity.
Okay. Just hold on for me, just in case you want to ask him a follow-up question.
I just want to ask him whether he has a sexual partner. If you have a partner, has your partner been treated? Have you taken your partner also to be treated? Because if you treat yourself and you don't treat your partner, and then you go have sex, maybe you'll be reinfecting yourself.
Okay, so if you're still on the line, has your partner also been treated?
Hello? Yes, she's also been treated.
Okay, no, there was a pause there. Is it one partner or you have more than one? That could also be a problem.
Yeah.
No, it's only one. But there's this one thing. Some of the symptoms. Is it like sometimes in the night you feel yourself itching, you scratch yourself to the next morning?
He's talking about something
else. Is it the inside or it's just?
No, all around my body. All around my body.
Your whole body itself?
Yeah.
Oh,
yeah, so this is not
my whole body itches. Then I scratch.
Okay, so where are you calling us from?
I'm calling from Asantuma.
Asantuma. You have a public health facility there?
Yes, we do.
Yeah,
we do.
There's a public health
facility. Okay. So what would be your advice?
Well, I think his is becoming more psychological because for most of the males that report with the discharges, after medicating them, what they do is that they come back thinking they should go back on the medication. If you have ruled out reinfection or poor compliance, they think they need to go back to the medication and then they continue taking it. And then when you overuse the antibiotics, this is what really happens. So there's a need to put a stop, report back to where he reported. I know they are also competent as we are in Greater Accra. You need to report back to them, then they will rule out all these factors I have talked about. And psychologically, get to know that once you have been medicated, it is gone, except that the person who medicated him will have to take a swab or anything to rule out any of the organism persisting in the genital organ. Okay. So he must go back. They are equally competent as we are in Greater Accra.
Okay. Unfortunately for us, I mean, our time is up, but I'm going to come to you so that you can wrap it up in your own way. What do you think we haven't highlighted that you want to?
you mentioned that you wanted us to talk about how to get the place tight.
Yeah.
Yes. In fact, it's not good at all for anybody to think that, especially for the women, to think that you want to make the place tight. The vagina it has some elastic. It's elastic in nature. It stretches and then it contracts and stretches. So if you put any medication to make it very tight, you are causing stricture, and you may get pain when you're having sex. Just leave the vagina as it is. Wash it with soap and water regularly. Keep your panties clean. Maintain a good personal hygiene, and you will not have problems.
Thank you. Those are very important tips I'm keeping. Okay, Auntie Julie.
Untreated sexually transmission infections can lead to complications. So it's very important that if anyone experiences any signs or symptoms, it's very important that the client visit the facility. And also important that the partner is also treated.
Okay.
And it's very important that they also take their drugs, because if you don't comply to the compliance, it will also cause a different. And it's important that once you go, they will ask you to come back after treatment, come back for a follow-up, where they will find out whether you are well or you need other information.
Yeah.
So all these points are very important. If you get a sexually transmitted infection.
Very well, thank you. Auntie, this, you can add the washing of the penis to what you say.
Exactly, yeah, to add on, it's very important. And early on we mentioned that whilst on medication, they should avoid sex. But then there are some people who cannot control their sexual desires. It's actually a need for every human being. So during that point in time when you're on medication, there's a need to use condom with your partner, and also the condom is very important. There is the only way we can also prevent these sexually transmitted infections. For instance, if you are not familiar with your partner, it's a casual one, even if it's your regular one and you have a suspicion, there's a need to consistently use the condom with the person to avoid STI, because the STIs, we always talk about the fact that they are the John the Baptist of HIV. When you have an untreated one, you are likely to be infected with HIV because you've opened the place up for any other organism to go. And also report to the health facility. Don't go medicating yourself at the pharmacy or the chemical shop. It won't do you any good, because when you go examining them, you might even find more than the STI they are complaining about.
Sure.
Yeah, because the perception may be different from what you, the trained person, have.
I don't know why I'm interested in this. Just 30 seconds. How do you wash the penis?
Oh, for the penis, it's normal. As you bath with the water you are bathing with, and as you wash yourself. Because many times I see some of the guys pulling it, and it's becoming a worry in the form of washing.
So don't pull it. I want to say thank you. Thank you so much for your time here. Thank you for this conversation. Very important. Beatrice Okon, Edith Asari-Mensah, and Juliana Sefa. They are all public health nurses. Thank you so much. I'm grateful for your time. Stay with us. We've got more coming up.